Where is the cure for cancer? President Obama's pledge to conquer cancer in our time is a great goal, but one of the leading experts on U.S. cancer not sure I'd use the word cure. The idea request the cure does not scare me because I do not think that is realistic in some cancers, said Dr. Otis Brawley, Chief Medical Officer of the American Cancer Society. But I like the general idea, and I'm very happy with the health care. The first Obama budget proposal includes $6 billion for cancer research by the National Institutes of Health. That's on top of the additional $10 billion provided by the stimulus package for 2009 and 2010. However, some cancer specialists say that instead of finding a cure for cancer, a more realistic scenario is that certain cancers that are deadly today are moving in the field of chronic disease. For chronic disease, doctors state, the way we think of diabetes or heart disease such as chronic diseases, where people could live in peaceful coexistence with cancer compared with cancer tries to move forward, he said Brawley. Dr. Tony Reed, an oncologist and director of clinical trials at Moores Cancer at the University of California at San Diego Center, agrees with this. He sees the long-term management of certain types of cancer as a chronic disease as a first intermediate step as researchers work to healing. Prevention efforts for smoking, obesity, and environmental risks are also important components of a cure for cancer, Dr. Andreas Ulrich, medical director of cancer control at the World Health Organization in Geneva, Switzerland. The time it really takes to cure cancer is unknown, but the initiative is encouraging, Obama said. We need this hope, Ulrich said. We have to invest our efforts in research, basic research, and also in the social sciences to understand why people behave in a risky manner, and how to avoid that people are exposed to risk of cancer, said. Because cancer encompasses more than 200 diseases, it makes sense that different varieties require different approaches to saving the lives of his victims. From the perspective of Brawley, a healing that occurs when the disease has disappeared and is not likely to return, and the person is likely to grow old and die of something totally unrelated. Reed wants to put it in terms of years of survival, with pancreatic cancer that normally live within 6 months after diagnosis, cure if we probably still alive 5 years after surgery, he said. But breast cancer can return even after 10 years, he said. About 11 million people in the United States had a history of any type of cancer from 2005, according to the latest statistics from the National Institute Surveillance Epidemiology and End Results Cancer Database. Progress has been made, however. For American men, the risk of death from cancer is 20% less than it was 20 years ago, Brawley said. The rates of new cancer diagnoses and deaths for men and women while U.S. fell for the first time since it began in 1998, according to a report published in November in the Journal of the National Cancer Institute. Already cancers that respond well to drugs for several years. Patients with gastrointestinal stromal tumors tend to tolerate the drug well, for example, Reed said. I have many patients who come back and say, except for the fact that you tell me I have cancer, I do not know, he said. But after a time, the cells of these patients' cancer mutate and evolve to become resistant to the drugs, finding ways to avoid almost any drug, said Reed. Some breast cancer patients take medicine for 10 years to prevent recurrence, said Drive. Stephanie Hines, a physician at the center of the chest within the center of the Mayo Clinic Cancer in Jacksonville, Florida. However, great strides have been made in these drugs, he said. There is real promise in time, eradicate breast cancer, he said. I would say maybe not in the next 5 or 10 years, but it can happen. Do not know if in our lifetime. However, only a few types of cancer are cured, and often depends on early detection. Breast cancer in early stage and testes are 2 of the few examples, Reed said. About 80% of lymphomas was cured, Brawley said. Metastatic lung cancer and metastatic breast cancer, however, are more likely to one day become chronic diseases, which would be treated over the life of a person rather than eliminated, Brawley said. Once this is metastatic spread, really cannot do surgery unless the patient wants to become a cherry-picking throughout the body, which does not really work, he said. Currently, some types of breast cancer are in decline even with chemotherapy. Cancer specialists compare these types of breast cancer as a smoldering going on from time to time and requires more water, Brawley said. The objectives in cancer treatments to extend the amount of time a person can live, that if a reasonable goal, he said. Medical specialists in cancer highlights Obama's initiative is a great asset to cancer research. I think all the tools are there, that's right, we have to do the hard work of testing them, evaluate them, and make them available to patients, Reid said.